Good morning. I want to present a case this morning to you. 75-year-old male came into the ER. Chief complaint of a 2-day history of fever, generalized fatigue, shortness of breath, dyspnea, and exertion. States today he felt very weak, felt the strength leave his legs, and he passed out. Upon evaluation in the emergency department, his temp was 102.1, heart rate 120, BP 108/53, room air sat 80%. Sepsis alert was called on this patient. ABGs were obtained, pH 7.44, PaO2 62, bicarb 19, base excess of -3.5. Chest x-ray showed no significant findings. Curb 65 score was 2 for ICU admission. This patient has a past medical history of CAD, COPD, hyperlipidemia, hypertension, hypothyroid, insulin-dependent diabetes, and an MI. He has past surgical history of cardiac stent placement, and important to note, he had a transurethral resection of his prostate in September. He has allergy to sulfa and latex. Home medications are listed as Lantus, simvastatin, tamsulosin, levothyroxine, furosemide, potassium chloride, cyanocobalamin, omega-3 fatty acids and fish oil, albuterol, Spiriva, metformin, lisinopril, and aspirin. He has no significant past family history. He has a 40-pack year smoking history, quit approximately 5 years ago. Let's talk review of symptoms. Constitutionally, he's fever, chills, weakness, fatigue, skin, no or itching. Cardiovascular, denies chest pain, pressure, or discomfort, no palpitations or edema. Respiratory, reports shortness of breath, dyspnea and exertion, cough, no sputum. GI, denies nausea, vomiting, or diarrhea. GU, denies burning on urination. Neurologic, no headache, no dizziness, positive syncope, no paralysis or ataxia, denies numbness or tingling in the extremities, no change in bowel or bladder control. Musculoskeletal, denies issue. Hematologic, no anemia, bleeding, or bruising. Psychiatric, no history of depression or anxiety. Endo, no reports of sweating, cold or heat intolerance, no polyuria or polydipsia. Physical exam, as stated above, vital signs 102.1, heart rate 120, respiratory rate 18, BP 108/53. Cardiac S1, S2, no gallops, rubs, or murmurs. Lungs are diminished throughout. Expiratory wheezing noted. Abdominal. Normal bowel sounds, soft, non-tender, non-distended. There's no CVA tenderness, no edema, no cyanosis or clubbing. Neurologically, grossly intact. Skin is dry and intact, no open lesions noted. Pleasant, conversant, oriented. Lab work, significant for potassium of 5.5, CO2 of 23, BUN 34, creatinine 1.79, random glucose 303, osmolality of 299. Urine cultures were sent, blood cultures were sent, patient negative for influenza A or B. Assessment and plan, acute on chronic respiratory failure with hypoxemia, COPD exacerbation, community-acquired pneumonia. Will need respiratory for O2 therapy, pulse ox, duonebs, empiric antibiotic therapy. Sepsis alert evidenced by elevated lactic acid level, fever, tachycardia, leukocytosis. Blood cultures, urine culture, monitor lactic level, antibiotic therapy, IV fluids. IDDM with hyperglycemia, monitor and control glucose, insulin sliding scale, PRN, resume home medications, carb control diet. Acute kidney injury, creatinine to 1.7, monitor and control IV fluid and avoid nephrotoxic agents. History of CAD, status post-stent, resume home medications. What's interesting about this case is that he was found to have Candida albicans in his urine and subsequently also in his blood. So I was rounding with the infectious disease doctor, and he talked about how the yeast was probably hanging out in this guy's bladder and eventually migrated into his blood, making him this sick. I just thought it was an interesting case to present. Have a great day. Thanks.